Welcome to WISE e-learning Module 3, WISE Phases and Activities Part A, Engagement, Assessing, and Teaming. In this module, as well as Module 4, we will learn more about the 6 phases essential to the WISE process that guide the intensive care coordination service component of the WISE program model. This module will focus on the engagement, assessing, and teaming phases of the WISE process. Through each of the phases that we will be discussing, WISE practitioners collaborate using a team-based approach. The term WISE practitioners is used to describe the collection of WISE certified staff roles required for each team. These roles include the care coordinator, the family partner and/or youth partner, and the mental health clinician. While it is typically the role of a care coordinator to facilitate and coordinate services and supports through these phases, which were adapted from the nationally recognized wraparound phases, all WISE practitioners should be partnering to meet the needs of the youth and family in the most effective way possible. Let's dive into the first phase, engagement. During this phase, the groundwork for trust and shared vision among the youth, family, and other team members is established, so people are prepared to come to meetings and collaborate. The tone is set for teamwork and team interactions that are consistent with the Washington State Children's Behavioral Health Principles, particularly through the initial conversations about strengths, needs, and culture. The goal of this phase is to begin to shift the youth and family's orientation to one in which they understand that they are an integral part of the process and their preferences are prioritized. Other goals of engagement include addressing any pressing needs and concerns so the youth, family, and team can effectively participate in the WISE process. Exploring the youth's and family's strengths, needs, culture, and vision. Orienting the family and youth to the WISE process, and to start gaining participation of team members who care about and can support the youth and family through collaborative participation on the team. Essential steps within the engagement phase include WISE practitioners meeting with the youth and family to explain the WISE process and how it differs from traditional care. WISE practitioners discussing with the youth and family the events, circumstances, and moments that brought the youth and family to WISE. Obtaining the youth and family perspective on where they are presently, including listening for both needs and strengths, and where they would like to go in the future. WISE practitioners discussing the youth's and family's view of crisis and developing a written plan to stabilize dangerous or harmful situations immediately. And WISE practitioners ensuring the youth and family understand any system mandates, if applicable, and ethical issues. During engagement, family partners meet with the family to explain WISE from a family's perspective, explain their role as family partner, and listen and learn from the family story. They invite the family to support groups and other activities of family support organizations. They help with making a plan to address immediate needs and in developing a plan for a crisis and pressing safety needs. Similar to a family partner, a youth partner uses their lived experience to work with the youth. They meet with the youth to explain WISE from a youth's perspective, explain their role, and listen to and learn from the youth's story. They invite the youth to support groups and other activities of youth support organizations. Youth partners also help with making plans to address immediate needs in crisis and pressing safety needs. The engagement phase should be completed relatively quickly, ideally within 1 to 2 weeks when possible, so that the team can begin meeting and establish ownership of the process. It is important to note that when a youth is coming into WISE from another program or placement, such as Children's Long-Term Inpatient Program or from Behavioral Rehabilitation Services and Inpatient Hospitalization or a Juvenile Justice Facility, this phase is especially important prior to discharge to assist in successfully transitioning youth back into their home and community. Also, important to know is for these initial phases to be Medicaid compliant and initial individual service plan under the direction of a mental health professional must be in place that directs the ongoing assessment and team development of services. Youth and families consistently tell us that they like to know what to expect from a process such as WISE, as well as what will be expected of them when they agree to participate. During engagement, WISE practitioners can help youth and families with thinking about their vision and where they would like their family to be in the future, or what does better look like. Thinking about the strengths of their family and preparing with them so that they can convey those strengths to other WISE practitioners. Considering their commitment to the WISE process. Discussing any immediate concerns, crisis needs, and pressing safety issues, as well as answering any questions or concerns the youth and family may have. In assessment, the next phase, and a natural continuation of the engagement phase, WISE practitioners expands the discussion with the youth and family to add context to the youth and family's involvement in WISE. In this phase, the WISE practitioners help the youth and family to understand that their input is central to the WISE process, and that their preferences in all phases of care planning and implementation will be prioritized. This includes helping the youth and family understand and incorporate any legal mandates into their plan. The WISE practitioners also listens to the youth and family perspective for more information about the youth's and family's strengths, needs, culture, and natural supports. The WISE practitioners orient the youth and family to the child and adolescent needs and strengths, or CANS, assessment, and continually review the CANS assessment results with the youth and family. The goals of this phase are to continue meeting and engaging to further understand the youth and family story and context, begin initial documentation of strengths, needs, and natural supports, including CAN scores, and to complete a youth and family approved narrative. During the assessing phase, WISE practitioners collaborate on the following essential steps: completing a strengths discovery and a list of strengths for all family members, discussing and listing existing and potential natural supports, completing a list of potential team members, summarizing the youth and family context, strengths, needs, vision for the future, and supports, and determining with the youth and family how the CANS information will be shared with the team. The youth partners and family partners' role during the assessment phase could include working with the other WISE practitioners to summarize the strengths, needs, culture, and vision of the youth and the vision of the family. They review documents including CAN scores with the youth and family to make sure the youth or family completely understands the documents and that they really reflect their view of themselves, their strengths, and the challenges they face. They can also help the youth or family in listing out existing and potential natural supports. During the assessing phase, youth and families should expect their documentation will be reviewed with them. It is important they feel comfortable to ask questions about their assessments, including CAN scores and subsequent documentation. Also, youth and families will approve the family story and narrative that was created during the engagement and assessment phases. The third phase is teaming. In the teaming portion of the engagement phase, WISE practitioners help the youth and family to reach out to potential team members who can commit to being part of the WISE Child and Family Team, or CFT. The building of this team is essential to successful planning and intervention. Let's take a minute to identify the various members of a child and family team. On each CFT, there are specific team members required. Each team member has a unique role on the team. These roles are the youth and family, a care coordinator, a family and/or youth partner, a WISE clinician, system partners, and natural and community support team members. The youth and family category refers to the youth and their identified family for whom the WISE team has come together to work for. Remember that if the youth does not have a legal guardian or parent in their lives, then ask them who they identify as their family. The role of the care coordinator is typically to organize and lead the WISE team meetings, facilitate communication among members, provide care coordination, and help guide the team through the phases and activities of WISE. Each WISE team will have a family partner and/or youth partner. One is required, both are optimal. The role of the family partner and the youth partner is to bridge the gap between the families, the youth, and the system's perspective. Sharing their lived experience is one way youth partners and family partners connect with peers and inspire hope. In order to qualify as a family partner or a youth partner, they must have lived experience, be WISE trained, and are a Washington State certified peer counselor. In addition to these qualifications, a family and youth partner must have a desire to share, teach, and empower the voice and choice of a family and youth. A mental health clinician is an important team member that not only provides direct services in the home and community, but also educates the youth and family team about therapeutic and behavioral approaches that may be helpful to implement. The WISE team also includes system partners from the different youth and family serving agencies, such as child welfare, juvenile justice, education, mental health, substance abuse, and other systems involved with the family and youth. And other natural and community support members like neighbors, kin, friends, and relatives help support the youth and family and play a critical role, especially after youth and families transition out of needing the level of care WISE provides. The goals of the teaming phase are to engage other team members, explain the team process, and elicit commitment to the process from team members, and to make necessary meeting arrangements. WISE practitioners provide the following information to potential team members regarding the process, what to expect, and the essential steps of this phase. The WISE practitioners explain WISE to potential team members, eliciting their perspectives and working to get their commitment to participate in the team process. Explain that the CFT will be expected to meet with sufficient regularity every 30 calendar days at a minimum, as indicated in the cross-system care plan, to monitor and promote progress on goals and maintain clear and coordinated communication. Describe how the CFT reviews the interventions and action items and adjusts these accordingly using outcomes indicators associated with each priority need, included on the cross-system care plan, also known as the CSCP. Describe how a WISE practitioner guides the team in evaluating whether selected strategies are promoting improved health and wellness for the youth and successfully assisting in meeting the youth and families' identified needs. Explain how the CFT works together to resolve differences regarding service recommendations, with particular attention to the preferences of the youth and family, as well as how the CFT has a process to resolve disputes and arrive at mutually agreed upon approach for moving forward with services. During the teaming phase, WISE practitioners, in partnership with the youth and family, invite potential team members to join the team process, while partnering and orienting these team members to the WISE process and the team meeting structure before attending a team meeting. The WISE practitioners help create the team meeting agenda, provide input about the logistics of the team meetings, such as time, place, etc., and ensure the youth and family feel comfortable in the meeting and answer any questions they may have. WISE practitioners are expected to check in with team members on progress made on assigned tasks between meetings. During the engagement, assessing, and teaming phases, you will spend time up front to get to know the youth and their family. It is important to meet them where they are at right now. It is also important to demonstrate that you really hear their story and value their goals to build trust and a strong therapeutic relationship, which are essential to the WISE process. This makes all subsequent phases easier to move through. Taking time within these phases to go slow will ensure that later in the process, things will go fast. Neglecting and/or skipping these steps will quickly derail the process, and the process moves toward case management as opposed to transformational and collaborative change. Thank you for watching WISE e-Learning Module 3. In the next module, WISE Phases and Activities Part B, you will learn about the last 3 phases of the WISE process: service planning and implementation, monitoring and adapting, and transition.